I'm Jamie Sheth, a clinical fellow from the University of Michigan, and I'll be giving you a summary of my poster presented at ATS entitled The Prevalence of Pulmonary Hypertension in Newly Diagnosed Patients with Idiopathic Pulmonary Fibrosis as part of the IPF PRO Registry. So pulmonary hypertension is known to complicate the course of idiopathic pulmonary fibrosis, but it's unclear if IPF with PH represents a distinct clinical phenotype. The presence of PH in IPF has been associated with higher mortality. However, the true prevalence of PH in IPF is unknown. One of our goals was to determine the prevalence of PH in newly diagnosed patients with idiopathic pulmonary fibrosis enrolled in the IPF PRO Registry. The IPF PRO Registry is a prospective outcomes registry, which is an ongoing longitudinal registry of newly diagnosed patients with IPF conducted at tertiary pulmonary care sites across the U.S. It is an academic industry alliance between Boehringer Ingelheim Pharmaceuticals as well as Duke Clinical Research Institute. pH in our study was defined as meeting any of the following criteria: a mean pulmonary arterial pressure of greater than 25 millimeters of mercury at rest on a right heart catheterization, or right ventricular systolic pressure of greater than 40 on an echocardiogram. We also included patients with a prior reported history of pulmonary hypertension. We included baseline demographics, spirometric data, as well as 6-minute walk distance, oxygen use, and use of pulmonary hypertension medications along with antifibrotic agents. Select comorbidities and symptom and quality of life scores were also compared between IPF patients with PH and without. Among the first 334 patients enrolled in the IPF PRO Registry, 33 met criteria for PH, approximately 10%. Their mean RVSP was 43.5, and their mean pulmonary arterial pressure was 32. A statistically significant difference was found between the PH and no PH groups in the following categories: age, diffusion capacity, supplemental oxygen use, St. George Respiratory Questionnaire total score, and short form 12 mental component summary. There was also a significant difference with the history of coronary artery disease, heart failure, sleep apnea, or COPD. We observed more emphysema on CT in the PH group, but the between group difference was not statistically significant. There was no statistically significant difference in the use of pulmonary vasodilators or antifibrotic agents among PH and no PH patients. Our conclusions from the study was that the prevalence of PH at baseline in our cohort is approximately 10%. PH was associated with increased age, lower DLco, supplemental oxygen use, and reduced health-related quality of life. The PH group had an increased frequency of coronary artery disease, heart failure, untreated sleep apnea, and COPD. Further analysis will be necessary over the course of the registry to identify whether these factors can predict the development of PH. Knowing patients at risk for PH could allow for early screening and intervention in at-risk subjects. Thank you for your attention today.